Depression and Anxiety in Older Adults by Shelby Driesman. What is depression and anxiety? According to American Psychiatric Association, depression and anxiety are defined as depression or major depressive disorder is a common and serious mental illness that negatively affects how you feel, the way you think, or how you act. Depression causes feelings of sadness and or loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Anxiety disorders are the most common of mental disorders that affect more than 25 million Americans. Causes of elder anxiety and depression. Not all older adults are depressed. NBCI National Library of Medicine states there are lower rates of depression and anxiety of older adults compared to their younger counterparts. However, the increased number among older adults should not be overlooked. There are many causes of depression and anxiety among older adults, such as losing a partner, loss of mobility, decreased health and well-being, diagnosis of a terminal illness, changes in the environment, such as moving to a new facility or losing a care provider, medications, and of course, genetics. Increased risk for depression and anxiety in older adults. It's important to note that depression is not a normal part of aging. Also, according to National Institute on Aging states depression and anxiety occurs with other mental illnesses. Illnesses can bring about or worsen depression. Many factors can put one at risk for depression and anxiety in older age, such as a stroke. A stroke can bring about depression or increase pre-existing signs of depression or anxiety. Diabetes, heart failure, cancer, Parkinson's disease, and of course, again, genetic predisposition. Signs and symptoms of depression and anxiety in older adults. Irritability, restlessness can happen in anxiety and depression, or excessive sleeping, which is mostly seen in depression. And to know, anxiety and depression do often go hand in hand with one another. Continuing on, low libido, feelings of hopelessness or guilt, immense irrational fear is often seen in anxiety, increased heart rate, eating less or weight changes, hard time concentrating or memorizing, frequent crying spells, aches, pain, GI tract issues, or thoughts of suicide. Prevention. There's many ways that you can prevent anxiety or depression in elderly age. Exercise. Stay in touch with family or friends. Plan out coping skills prior to major changes such as moving. Eat a well-balanced diet. Be proactive rather than reactive, such as engaging in therapy early on. Make it aware to others when you are feeling signs and symptoms of depression. Pick up a new hobby that you once enjoyed. Treatment. National Institute of Aging states psychotherapy, also called talk therapy, can help people with depression. Some treatments are short-term, lasting 10 to 20 weeks. Others are longer, depending on the person's needs. Psychotherapy can help one alleviate their negative thinking patterns associated with depression and anxiety and develop them into healthier thinking patterns through cognitive behavioral therapy. Antidepressants can also help an individual suffering from depression. There are many antidepressant pills that an individual can test and trial with through their primary care provider until they find one that works for them. Antidepressants increase serotonin levels to alleviate depression because depression is associated with low serotonin levels. Here are some resources that the National Institute of Aging website provided to help individuals suffering to seek help. If you witness any signs or symptoms of depression, or you are suffering from any signs or symptoms of depression or anxiety, seek help immediately. There's the American Psychological Association, Depression and Bipolar Support Alliance, National Alliance on Mental Illness, Mental Health America, National Institute of Mental Health, National Suicide Prevention Lifeline. In conclusion, there are a lot of signs, symptoms, and risks for depression and anxiety of older adults. However, there are many treatments to prevent one from suffering. If you're suffering or witness one suffering from depression, seek help quickly. Take control of your life and take control of your life and happiness again.